Hi, today I want to talk about LDL cholesterol and coronary artery disease. Now, most of you, if you've been into your doctor's office or cardiologist's office, there's a lot of focus on your LDL level, low density lipoprotein. And so LDL is the type of transporter that brings cholesterol into your arteries. And we have the good cholesterol, the HDL, which brings cholesterol out of our arteries to our liver to be metabolized. And so there's a lot of focus on lowering LDL cholesterol. Now, what's interesting, when you really look into the details on this, there's a lot of mixed research. As a matter of fact, lowering levels of LDL cholesterol really isn't the panacea it's been made out to be. It is a risk factor, but I would say it's not the risk factor. And so most people go in their doctor's offices and they're on medications trying to lower that LDL cholesterol. Well, as it turns out, LDL cholesterol, as with most things in our body, has a very specific design. It has many different functions. It's part of our immune system. It has antioxidant properties and delivers nutrients around in our bloodstream. It makes up our cell membrane. So very, very important functions. You get the levels too low and you can have problems with your immune system, problems with memory, things of that nature. So I was very interested in this large study that was published in the American Heart Journal. And here researchers analyzed the data of more than 230,000 people who were hospitalized with coronary artery disease. So we have plaque plugging up your arteries. And they found about half of them had LDL levels less than 100 milligrams per deciliter. So when you look at lab tests nowadays, most of them say they'd like you to be below 100, although few people are naturally. People who don't have heart disease, don't have diabetes, a lot of doctors like myself are comfortable with levels less than 130. In any event, it goes to show that this, amongst other pieces of very good research, that LDL in of itself probably gets overemphasized in terms of reducing people's cardiovascular risk. And it may be interesting for you to know that the standard lipid panel, where you get the total cholesterol, the good HDL, the bad LDL, the triglyceride levels checked, it fails to identify 60% of people who are at risk for cardiovascular disease. So that panel, which most of you are getting, has really become antiquated in a way. And that's why at the Stengler Center for Integrative Medicine, other more cutting-edge clinics, integrative centers, preventative cardiology, we're using much more advanced testing. Yes, we'll do the standard lipid panel, but much, much more. That only makes up maybe 20% of what we test. And so we're looking at the more cutting-edge things, which are more predictive in nature, like the particle size of your LDL and HDL cholesterol. That seems to be more important. We're looking at some of the genetic risk factors. We're looking at nutrients. For example, we know people that are deficient like omega-3 fatty acids, magnesium, for example, are high risk. Or people who have high iron levels are at high risk for heart disease. Very importantly, we look at the markers of inflammation. We look at C-reactive protein. We look at a substance called lipoprotein-associated phospholipase. And what that is, that's an enzyme that's involved in inflammation in the arteries. And it's an indicator that there could be plaque formation because of inflammation going on in the arteries. As well, we look at other things such as oxidized LDL. That's the damaged form of LDL cholesterol. And when that becomes oxidized or damaged, then your immune system comes in, creates an inflammatory response, as well as plaque formation. So these are just some of the things we test, which give us much more predictive value than the old standard panel. And then obviously we want to focus on things like diet, lifestyle, nutraceuticals that are very cardiovascular specific, depending what your blood work shows. So I highly urge you to work with a doctor who's going way beyond the standard traditional panel, a doctor who's not just really focusing on your LDL cholesterol, because you're really going to miss perhaps the bigger factors involved in your cardiovascular risk if you're using this old method.